Hi, and welcome to our telehealth video information series. I'm Garvin, and this video is on Fucibet cream and Fucibet lipid cream. So what is Fucibet cream and lipid cream used for? Fucibet cream and Fucibet lipid cream are used to treat infected eczema or dermatoses. Both creams contain beta-metasone 0.1%. So this is a potent steroid to reduce skin inflammation, and together with an antibiotic called fucsidic acid, and this treats bacterial infection. So how does Fucibet work? Beta-metasone is a type of a medicine called a topical corticosteroid. It works by stopping skin cells releasing various inflammatory substances that make blood vessels widen and cause the skin to become red, swollen, itchy and painful. It reduces the swelling, redness and itching, and so helps prevent scratching that can further irritate the skin. Fucsidic acid is an antibiotic medicine used to treat infections with bacteria. It works by stopping bacteria from producing essential proteins, without which the bacteria cannot grow and increase in number. The remaining bacteria die or are destroyed by the immune system, and this clears up the infection. So who shouldn't use Fucibet cream? Fucibet can be used by most people, including adults, the elderly, and children and babies. However, Fucibet lipid cream should not be used on children under 6 years of age. If you're using Fucibet on a child, don't apply it to large areas of skin or underneath nappies unless your doctor specifically tells you to. Don't use it on areas of skin affected by bacterial skin infections that aren't associated with eczema or dermatitis, for example, impetigo, and fungal skin infections such as athlete's foot, ringworm, or candida skin infections. And also don't use it on viral skin infections such as chickenpox, shingles, or cold sores, or herpes simplex, and lesions caused by tuberculosis or syphilis. Also don't use it on acne vulgaris, which is spots, and acne rosacea, which is a skin condition called perioral dermatitis, which is a red spotty rash around the mouth, and also widespread plaque psoriasis. So can I use Fucibet cream while pregnant or breastfeeding? Only if your doctor thinks it's essential. So you discuss this with your doctor. And how do you use Fucibet? Wash your hands before applying the cream. Fucibet should be applied thinly to the affected areas of skin, as directed by a doctor. The cream is usually applied twice a day, morning and evening, 12 hours apart. And don't use the cream on your face unless instructed to by a doctor. Don't apply it to broken skin or the genitals, and take care to avoid getting the cream in your eyes, nose or mouth. Rinse it off with water if you accidentally get the cream in these areas. Wash your hands thoroughly after applying Fucibet, unless the hands are the area being treated. Don't cover the treated areas with dressings. This includes bandages and nappies, unless directed to by a doctor. Dressings can increase the absorption of this medicine, which can increase the risk of getting side effects. And don't use the cream for more than 7 days unless instructed to. If the infection doesn't seem to be clearing up within 7 days, or if it seems to be getting or spreading or getting worse, you should go back and see your doctor. It's important that you don't use Fucibet for longer than the prescribed period. Prolonged use of potent steroids like Fucibet can cause side effects, and repeated use of antibacterial medicines can cause the skin to become oversensitive or allergic to the medicine. It may also result in the bacteria becoming resistant to the antibiotic. So what are the side effects of Fucibet? So uncommon side effects would be skin irritation such as redness, rash and itching, and a burning sensation after applying the cream, and allergic inflammation of the skin, so contact dermatitis. So stop using Fucibet and see your doctor if you think you've experienced a reaction or your skin condition appears to be getting worse. And thinning of the skin also be a side effect, and reduced skin pigmentation and stretch marks, and fine blood vessels become prominent under the skin, and excessive hair growth. So on rare occasions, enough corticosteroid may be absorbed to have side effects on other parts of the body. For example, a decrease in production of natural hormones by the adrenal glands, or Cushing's syndrome. If you experience any changes in your vision while using Fucibet, such as blurred vision, you should tell your doctor. And read the leaflet that comes with your medicine. Or talk to your doctor or pharmacist if you want any more information about the possible side effects of Fucibet. So can you use Fucibet with other medicines? So make sure to tell your doctor or pharmacist if you're already using any other medicines, particularly if you're using any other corticosteroid medicines, including those bought without a prescription, before you start using Fucibet. If you need to use other topical medicines on the same area of skin, it's recommended you leave several minutes between applying each product. This is to allow each product time to be absorbed and avoid the mixing on the skin. If you apply moisturizers shortly before or after applying Fucibet, they can dilute the medicine and potentially make it less effective. So try to apply moisturizers at a different time of day, or at least 30 minutes before or after using Fucibet. So that brings this video to an end. If you have any questions, leave them in the comments below, or you can contact us at Lynch's Pharmacy in Douglas and Cork, or ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.